This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to be discussing hypoadrenocorticism or Addison's disease. Come here, Figo. Come here. Come here. Oh boy. So in today's video, I've got my buddy Figo here, who I'm dog sitting or we're house sitting. He just so happens to be a Portuguese water dog. So he is one of the breeds that are really at the highest risk of having Addison's disease. So generally, some of the breeds are more prone to it. And the breeds I'm thinking of are Portuguese water dogs, the Great Danes, all breeds of poodles, standard poodles down to little miniature-sized poodles, bearded collies. The little Westies or the West Highland White Terriers are also prone to Addison's disease. But generally, it's a disease. It occurs twice as often in female dogs as in male dogs. It's a disease generally diagnosed, around 4 to 5 years. We're looking at these young female dogs, typically, in the prime of their life, that have this pretty unusual disease that can be really difficult to diagnose. So Addison's disease, what is it? So in particular, Addison's is about a deficiency of a certain number of hormones that are not being secreted by the adrenal gland. And this is a gland that is located in front of our kidneys, in front of our pets' kidneys. It's primarily a disease that we see of dogs. And so they're not producing generally a couple of specific hormones. So these are the steroid hormones. So think of cortisol. Think of a hormone called aldosterone, which helps regulate the electrolytes, primarily regulating sodium and potassium. So in terms of some of the clinical signs, do I have a dog that has Addison's disease or this hypoadrenocorticism? So generally in the veterinary world, and I did diagnose it in a number of dogs, it would initially be presented a dog that's sort of a history of just sort of ain't doing right. And it could be periods of listlessness, GI signs, vomiting, diarrhea, repeated bouts of illness, or they get really sick easily. Something such simple such as a bladder infection could just send them into a serious clinical crisis. And typically, and more often than not, I see these sort of young, healthy dogs coming in shock, presenting with signs of shock. So what's happening, and if you could think about how the disease works, is you've got this adrenal gland, which is supposed to be producing these specific hormones, such as cortisol, aldosterone, and they're essentially preparing your body, your pet's body, for the fight or flight response. So when it's producing cortisol, which is initially and during times of fight or flight, the cortisol is there to mobilize all this blood sugar, so your cells have energy to fight or flight. Secondly, too, it's producing these mineralocorticoid hormones, such as aldosterone. It's trying to regulate the electrolytes, because once again, the body is anticipating potentially there's going to be a fight or flight. You might be about to lose some blood, meaning you're going to lose these key electrolytes. So what the body is trying to do in this time is then, conserve sodium, lose some additional potassium that's not needed in preparation for that. But when the disease, Addison's disease, is happening, these two specific hormones are not being produced. Hence, you see some of these bigger clinical changes in terms of this dog coming into the veterinary clinic who essentially got signs of shock. We go ahead and do some blood tests on him, thinking why is this dog shocky? Is he eating something, for instance? Is it a sudden poisoning, especially this young female dog? No history of trauma, for instance. And typically what we'd see on a blood panel would be, this dehydrated animal. Potentially it might have slightly elevated kidney values, and we might think, is there kidney failure going on? But then when we go ahead and look at some of the electrolyte levels, what we should see in a dog that's Addisonian is they're going to have elevated potassium. That's high potassium, which should never be elevated, and generally low sodium. And that's pretty diagnostic in terms of a pretty good indicator that yes, this dog is in an Addisonian crisis and needs treatment. So part of the reason why we're seeing these dogs come in, collapsing with shock, is they would have low blood sugar, which is really should trigger big warning signs. Why is this happening? And this elevated potassium, which can cause heart arrhythmias and other secondary serious cardiac complications, causing shock. So then the initial main treatment is getting your dog on IV fluids. So we're looking at just plain sodium chloride, not like lactated ringers. You want to make sure that the fluid going into your dog is going to lower that potassium level, because that's pretty much life-changing in terms of that potassium stays high and gets higher. It can cause a fatal cardiac arrhythmia. Your dog can die of a heart attack. But we want to make sure that the fluid going in contains no potassium. So that's why we're just looking at just plain on sodium chloride, not something like lactated ringers. Then as well too, we may be looking at adding in some additional glucose to get their blood sugar levels back to normal. Essentially, that's the primary initial treatment, but it requires IV fluids, someone to correctly diagnose it, or make that basic baseline assessment, so they're treating your dog correctly. The key diagnostic test, then, there's one called an ACTH stim test, and that's what your veterinarian should then be performing on your dog, and that essentially is going to confirm the diagnosis of Addison's disease. One big caveat there is if your dog's been on some type of steroids prior to that, say if you've got an allergic dog, he's on prednisone, that's then going to complicate the test. But generally, that is the diagnostic test. It's an ACTH stim test, and what you expect after you give that is your dog should then produce these adequate level of cortisol. It should respond appropriately to the ACTH stim. A dog that is Addisonian, he's got an adrenal gland that's not responding appropriately, and he's got really low levels of cortisol after the fact, and essentially there's your diagnosis. You've got a dog with Addison's. If your dog has been into the veterinary clinic, diagnosed with Addison's disease, what should you look at doing first? There's something natural you can give. There are, but the first big thing, go boy Figo. The first big thing is, getting your dog on the appropriate conventional medication. You need to regulate the hormone levels. In particular, your dog needs to regulate sodium and potassium. So first thing you need to be looking at doing is there's a medication called Florinef. Comes as an oral tablet. Works really well, and essentially it's replacing the hormone that your dog's adrenal gland is not producing. Yes, it's one your dog is going to have to be on for life. Works great, but he needs to be on that. You need to have that hormone being produced. Most dogs also start out on prednisone because they're also low in cortisol, and that's sort of the conventional way to replace the lost cortisol. And the majority of guys are going to start on something like Florinef and also on the Pred. So in terms of some of the natural holistic options in terms of to help your dog, if you've got a dog that has Addison's disease, one, you want to be thinking about something that's going to help potentially boost or support this less than functioning adrenal gland, and potentially look at treating some of the underlying causes. So, like, why is that adrenal gland not functioning the way it should be? Has it been attacked, for instance, as far as the immune system? Is there an overactive immune system? There's obviously some type of inflammatory process has gone on to affect your dog's adrenal gland cells. In people, they talk about adrenal fatigue. It's a huge issue right now amongst our whole human population, and such a big key link. And they talk about to diet and or stress and some of the environmental potential toxins that are then affecting our adrenal gland. So some of the bases I think you can really also apply to your dog. So first of all, you want to think about really looking at what you're feeding your dog as far as diet-wise. You want to make sure you got a whole bunch of key nutrients in their diet, and you don't have anything in there that's potentially going to be inflammatory or reactive. So if your dog is on sort of a pretty lower quality dog food, get them on a better quality dog food. Make sure, try to minimize some of the inflammatory nutrients, such as the grain, corn, etc. Look at trying to increase the amount of animal protein in that diet, and if there's things like soy, get that out of the diet. Preferably sort of a natural type diet. 2, look at making some of your dog's food at home, and ideally something like the stews. You're going to also combine meat and vegetables. And try to minimize the carbs. If you're going to use a carb, use something that's got potentially healthier, such as sweet potato, for instance, as opposed to wheat or corn. And even consider some of the raw food. Like, really mix it up, but really think about what is nutritious for you. For the most part of it, it's nutritious for you. It's also nutritious for your dog. 2, look at a good vitamin mineral supplement One that's going to, limit the chance of your dog once again having an Addisonian crisis. To one that's going to contain some of those antioxidants, vitamin and minerals, such as my supplement, Ultimate Canine Health Formula, where I have vitamin C, I have vitamin E, I have selenium, I have zinc. Some of those vitamins and minerals that we know are going to prevent against this free radical damage, which is just part of the everyday process of what happens. This is always going on in our body and our pet's body. Cells produce free radicals, based on inflammatory changes. Stuff is always happening within our bodies, our pets' bodies. And we think if there's too many free radicals being produced, we're increasing the likelihood of cell damage, such as cell damage to your dog's adrenal glands, which has then led him to be Addisonian in the first place. Flavonoids, this is a mixed flavonoid, bioflavonoid supplement, and these are ones in particular that are even more beneficial in terms of being, anti-free radicals, protecting against free radical damage. Some of the thought is if you've got a real overactive immune system, some of these dogs have allergies, for instance. The thought is sometimes they can have, their immune system then attacking things that shouldn't be, such as the adrenal gland. So some people are finding, if they get themselves on a mixed bioflavonoid supplement, in particular look for one that contains green tea. ECGC is the actual supplement in green tea. There's the flavonoid that is potentially beneficial. That also may be beneficial for your dog. The essential fatty acids, which I've discussed for a whole array of diseases, no question, they can also be beneficial if we've got adrenal gland insufficiency or we've got Addison's disease. And first of all, they're not going to do any harm. They have a whole lot of upside. A real inexpensive one, which I've discussed in the past, is using flax oil. But you need to be doing a high dose. We're looking at 1,000 milligrams per 10 pounds of body weight, and I'd be even looking at doing it twice daily. Start out at once daily, let your dog get acclimatized for 2 to 4 weeks, then up the dose. So if you're looking at that amount of flax oil, would be about 1 tablespoon per 40 pounds of body weight. The one herb that is often discussed and that some people have really found helpful for their dogs that have Addison's is this herb licorice. And it's one which, if you're going to be using it, I want you to be using in conjunction with your veterinarian. You're discussing, this is what I'm giving. In terms of, licorice is seen as kind of the natural cortisol. So it actually does help stimulate the adrenal gland. So it's one that we'll give, for instance, to these allergic dogs. They have these allergic flare-ups because we know it'll stimulate the adrenal gland and then produce some of the hormones, such as producing more natural cortisol, making your dog less itchy. So it's one we know will actually help the adrenal gland. In terms of looking at a licorice dose, so if you're dosing the tincture, you're doing about a half a mil per 20 pounds of body weight. So for something like Figo, who's 40 pounds, he would be getting about a mil. And I'd start out with a mil once a day. After about 2 weeks, assessing the response, look at boosting it up to a mil twice a day. But it's one you want to be doing it in conjunction with your veterinarian. So you guys can look at measuring potassium, sodium levels, adjusting Florinef doses if you needed to, and also assessing his response. Ashwaganda is a herb which is increasingly being used by people that have, this adrenal fatigue. And a number of different alternative practitioners are using it with animals that have Addison's disease. So once again, it's called an adaptogen. So it's thought that actually it'll aid these glands, which are, they're not able to adapt, say, to the environmental stressors that are happening, maybe the reaction that your dog is having with the food he's eating, for instance. And it actually helps that gland itself, they're said to call adaptogens, to adapt in terms of to start to function normal again and deal with what is coming at it. So once again, it's a herb which is specific for the adrenal gland, and a number of people using it for adrenal insufficiency themselves. And once you're looking at doses, it's similar to if you're using a tincture, similar to how I just discussed with the licorice. You'd be using about a half a mil for 20 pounds of body weight, starting out once daily. But once again, I'd be encouraging you to be discussing this with your veterinarian before you start on ashwagandha as well. Lots of you guys asking about homeopathics. And a little bit of research. So the most commonly prescribed homeopathic for Addison's disease is Arsenicum album, and it just so happens that's probably the homeopathic I've used the most often. It's one, anytime we think about, you know, this dog who's acutely vomiting, for instance, or they've probably got into something, they've got garbage gut, I always think about Arsenicum, and so many dogs respond to it. It's a real good homeopathic as one for you guys to sort of start with if you've yet to use one. So when you're looking at giving Arsenicum for Addison disease, you'd be looking about one capsule for about 20 pounds of body weight, and given twice daily. 2 or 3 different herbs, Nettle, Dandelion, Alfalfa, which are sort of these herbal tonics which I've used for a whole variety of different, you know, veterinary conditions. But the thought is they're not there to sort of cure one specific disease. But they help things such as the organs function more effectively, help things such as glands which aren't functioning as well, you know, such as this inactive adrenal gland, potentially function a little bit better. They're super nutrient dense, and a real easy one to use or to start with is Dandelion. I'm actually drinking some Dandelion root tea now. It's one I'd want you to actually have a mixture of the Dandelion leaf, Dandelion root. If you wanted to give it as a tea, that would be fine. If you wanted to get it, you know, get it all in sort of dried formation and trying to mix it into your dog's food too, that would be fine too. In terms of looking at the tea dose, typically I'm looking about a teaspoon per 10 pounds of body weight twice daily. For something like Figo here, I know you could just sort of squirt it into his water bowl and he'd probably happily drink it. It's got a whole lot of upside, a whole lot of benefit, pretty nutrient dense, can really help your dog, and may very well help your dog if he's Addisonian. So thank you, Figo. Thank you guys for watching this edition of Vet Secrets. Yes, you're a good boy.